If you're over 60 and you can still do these 7 things without help, you are not just doing fine for your age. You are actively protecting the one thing almost everyone your age is quietly afraid of losing, your independence. I'm Dr. Michael Hartley, and for more than 20 years I've worked alongside surgical teams evaluating patients before major operations. Before any surgery, we don't just check blood pressure and blood work. We assess something called physical reserve, how much capacity a person's heart, lungs, muscles, and nervous system have left in the tank when the body is put under real stress. And here's what stays with me after 2 decades of this work. I've watched 2 patients, same age, same diagnosis, same operation, roll into that same operating room and have completely different outcomes before the surgeon even picks up a scalpel. One walks in unassisted, laughing with the nurses. The other needs 2 people just to help them onto the table. That gap is almost never random. It's the visible result of years of small choices that either built physical reserve or slowly drained it. I remember one particular pair of patients vividly. Both were 74. Both were scheduled for the same routine procedure, on the same morning by the same surgical team. The first man had spent the last decade taking a brisk walk every morning and doing light resistance training twice a week. He was up and moving the same evening after surgery, discharged a full day earlier than expected. The second patient, who had been far less physically active in the years leading up to that morning, spent an extra 4 days in recovery, developed a minor complication that likely could have been avoided, and needed weeks of physical therapy afterward just to return to his normal routine. Same age, same procedure, completely different trajectories. The difference wasn't luck, and it wasn't genetics alone. It was physical reserve built or lost over years of daily choices. Today, I want to walk you through 7 signs that your body is aging exceptionally well. Most of them you can check yourself right now in your own living room with no equipment at all. By the end, you'll know exactly which of these underlying systems in your body need the most attention. And more importantly, which ones can still be rebuilt, no matter your age or where you're starting from today. Let's start with something researchers now consider a genuine vital sign, on the same level as blood pressure or heart rate, how fast you walk. That might sound too simple to matter. But walking efficiently is actually one of the most demanding coordination tasks your body performs. It requires your cardiovascular system to keep up with oxygen demand, your muscles to fire in the right sequence, your joints to move without restriction, your inner ear and vision to maintain balance, and your brain to orchestrate all of it in real time dozens of times per second. That's precisely why walking speed tends to decline before almost anything shows up on a lab test. It's often the earliest visible signal that one of those underlying systems is starting to lose ground, long before you'd notice it any other way. Large studies following older adults for years have consistently found the same pattern. People who walk faster live longer, and this holds true even after researchers control for other diagnoses. A comfortable pace of roughly 3 feet per second or faster is associated with meaningfully better long-term outcomes. Significantly slower than that, and your risk of complications tends to climb. Here's the part that should give you hope rather than anxiety. Walking speed is one of the most trainable markers on this entire list. Regular walking, especially sessions where you deliberately push your pace for short intervals, has been shown to measurably improve walking speed, even in people who start well into their 70s. Quick self-check. Time yourself walking 30 feet at your normal, comfortable pace. If it takes you 10 seconds or less, you're in a strong range. What makes walking speed such a uniquely honest signal is that it can't easily be faked or compensated for. Unlike a single strength test performed in a doctor's office, your everyday walking pace reflects how all of your systems are performing together under real-world conditions day after day. That's part of why clinicians increasingly track it alongside blood pressure and pulse during routine visits. It captures something those other numbers simply can't. If your pace has slowed noticeably over the past year or 2, that alone is worth paying attention to, even if nothing else feels obviously wrong. It's often the canary in the coal mine, showing up months or even years before a specific diagnosis would. Next is a measurement that surprises almost everyone the first time they hear about it: grip strength. It sounds oddly specific, Why would how hard you can squeeze something matter for your overall health? But grip strength turns out to be a remarkably accurate proxy for your total body muscle strength and what physiologists call your physiological reserve. Essentially, how much physical capacity you have banked for when your body actually needs it. The reason it works as a proxy is straightforward. The same neuromuscular systems that produce a strong grip are closely tied to the strength of the larger muscle groups throughout your body. Research has linked weaker grip strength to a higher risk of falls, slower recovery from illness or surgery, and reduced longevity overall. It is one of the cheapest, fastest tests in all of medicine, and yet it tells us an extraordinary amount. The encouraging news, again, is that grip strength responds very well to training. You don't need a gym membership. Carrying groceries, using resistance bands, or doing basic strength exercises just twice a week can produce measurable improvements at almost any age. Quick self-check. Can you open a stubborn jar lid, carry 2 full grocery bags from the car in one trip, or hang from a bar for even a few seconds? These everyday tasks are rough, real-world grip tests. What I find most compelling about grip strength as a marker is how early it tends to change relative to other signs of aging. Muscle mass and strength don't decline uniformly across the body. They tend to erode first in whichever muscles are used least. And for many people in midlife and beyond, that includes the small, specific muscles of the hand and forearm. That's precisely why it functions so well as an early warning system. By the time weakness becomes obvious in the large muscle groups you rely on for walking and standing, grip strength has often already been signaling the trend for months or years. The training response is also faster than most people expect. Unlike some physiological markers that take many months to shift, meaningful improvements in grip strength have been observed in as little as 6 to 8 weeks of consistent resistance work, which makes it a satisfying marker to track because the progress becomes tangible relatively quickly. The third marker is your cardiopulmonary fitness, how efficiently your heart and lungs deliver oxygen to your working muscles. In research, this is measured as VO2 max, and if you happen to wear a smartwatch, you may already have a rough estimate of your own. Here's what should get your attention. VO2 max has repeatedly emerged in research as one of the single strongest predictors of longevity we currently have. In some studies, outperforming even smoking status or a diabetes diagnosis as a predictor of how long someone will live. The logic makes sense once you think it through. A body that can efficiently deliver and use oxygen simply has more reserve to draw on when it's challenged by illness, by surgery, by infection, or by nothing more dramatic than the everyday physical demands of staying active and independent. The good news is that cardiopulmonary fitness is one of the most trainable systems in the entire body at virtually any age. Brisk walking, cycling, swimming, or any activity that consistently elevates your heart rate for sustained periods can produce measurable improvement even when you're starting later in life. Quick self-check. Can you climb 2 flights of stairs without stopping to catch your breath? Can you hold a conversation while walking briskly? These are informal but meaningful indicators. It's worth pausing on why this marker outperforms so many others as a longevity predictor. Your cardiovascular and respiratory systems are involved in essentially every physiological process your body performs. Healing a wound, fighting an infection, recovering from anesthesia, even regulating mood and cognitive clarity. When that oxygen delivery system is operating efficiently, every other system downstream benefits from it. When it's not, everything else has to work harder just to keep up. This is also the marker where consistency tends to matter more than intensity. You don't need to train like an athlete to see meaningful gains. 3 to 4 sessions a week of moderate aerobic activity, sustained for 20 to 30 minutes, has repeatedly been shown to shift this number in a favorable direction, even for people who haven't exercised regularly in years. If this is already reshaping how you think about healthy aging, take a second to subscribe. It genuinely helps this information reach the people who need it most. And there are 4 more signs still to go, including one most people have never even heard of. Now let's talk about balance, because this connects directly to one of the deepest fears people carry about growing older, falling. Balance is a coordination act involving your inner ear, your vision, the sensory feedback from your feet, and your muscle strength, all communicating with your brain in real time. As we age, each of these systems can quietly decline without any obvious warning sign, and balance is very often the first place those small declines become noticeable. Here is the point I most want you to remember. A fall isn't just a bruise and band-aid injury risk. A serious fall during your 70s or 80s is one of the single leading causes of people losing their independence altogether, sometimes permanently. That's exactly why balance training matters so much, and it doesn't require anything elaborate. Standing on one leg, practicing Tai Chi, or doing basic stability drills a few times a week has an outsized impact on long-term independence. Quick self-check. Stand on one leg with your eyes open and time yourself. This simple, trackable test gives you a meaningful benchmark you can revisit every few months to see whether you're improving. What surprises most people is how quickly balance can be trained back, even after years of decline. Because balance relies on the brain's ability to integrate signals from multiple systems at once. And because that integration process is remarkably adaptable, even a few minutes of deliberate practice most days of the week can produce noticeable improvement within a matter of weeks. This is one of the clearest examples in the entire body of a use it or lose it system that responds just as readily in the other direction toward improvement once you start training it deliberately. I'd also gently push back on a common assumption here, that balance problems are simply an inevitable part of getting older, something to be managed rather than improved. In my experience, that's rarely true. Balance is a skill in the same way that any coordinated movement is a skill, and skills respond to practice regardless of the number of candles on your birthday cake. This next one is, in my experience, the most revealing test on this entire list, and also the one people are most surprised to learn is scientifically validated. Your ability to sit down on the floor and stand back up again without using your hands or arms for support. Researchers refer to this as the sitting-rising test, and it's used in real aging studies for good reason. To perform it, your body needs leg strength, core strength, balance, flexibility, and coordination, all working together simultaneously. It's essentially a full-body stress test disguised as a simple movement. Long-term studies following adults for years found that people who could not perform this movement without using their hands for support had a significantly higher risk of death in the years that followed compared with those who could. This isn't about being athletic or flexible in some impressive way. It's a direct window into whether your body still has the combined strength, mobility, and coordination that everyday independence actually requires. If you tried this and couldn't do it, please don't panic. Like every other marker on this list, it's trainable. Practicing the individual components, squatting, kneeling, and pushing yourself up from a low position gradually rebuilds the strength and coordination needed to perform the full movement with confidence. Quick self-check. From standing, lower yourself to a seated position on the floor, then stand back up, using as little hand support as possible. Note how many points of contact you needed. I bring this test up in almost every conversation I have with patients about long-term independence because it captures something the other markers on this list can each only partially reveal. Walking speed tells you about cardiovascular coordination. Grip strength tells you about muscular reserve. But the sitting-rising test asks your entire body to solve a real problem simultaneously, the same way an actual fall or a sudden loss of balance would in everyday life. It's as close as we get to a real-world rehearsal, performed safely on your own living room floor. If you found this one genuinely difficult, I'd encourage you to treat it less as a verdict and more as a starting point. Begin with assisted versions, using a chair or couch for partial support, and gradually reduce how much you rely on it over several weeks. Small, consistent practice here tends to produce some of the most visible improvement of any marker on this entire list. Here's a marker almost nobody talks about, and one I consider genuinely underrated. Can you comfortably turn your head to check over your shoulder while continuing to walk in a straight line without stumbling or slowing dramatically? This is called dual task walking, and it reveals something the other tests can't: how well your brain manages two demanding tasks at once. Walking itself is automatic for most healthy adults, but adding a second task, turning your head, checking on traffic, carrying on a conversation, forces your brain to divide its attention. Research on aging and fall risk has found that a significant drop in walking steadiness when a second task is added is one of the more reliable early predictors of future fall risk, sometimes appearing before any change shows up on standard balance tests. The reassuring part is the same as everywhere else on this list. This ability responds to practice. Deliberately walking while doing something else, carrying a light object, having a conversation, scanning your surroundings, trains your brain and body to handle real-world multitasking more safely. Quick self-check. While walking in a hallway or open space, turn your head fully to one side and hold it for a few seconds. Do you drift off course or lose your rhythm? This particular marker matters enormously for real-world safety because the moments that lead to falls almost never happen in a controlled setting where you're focused entirely on your footing. They happen while you're distracted, glancing at a car before crossing a street, answering someone who called your name, reaching to pick something up while still walking. If your body can't handle divided attention smoothly, those are precisely the moments where risk quietly accumulates. The good news is that this too responds to deliberate, gradual practice and doesn't require anything beyond a hallway and a bit of patience. The final sign is one that's easy to overlook because it isn't about what you can do in the moment, it's about how your body responds afterward. After a flight of stairs, a brisk walk, or an active afternoon, how long does it take for your breathing and heart rate to settle back to normal? And how do you feel the next day? This recovery capacity reflects something researchers call physiological resilience, your body's ability to absorb a stressor and return to baseline efficiently. It draws on nearly every system already discussed: cardiovascular efficiency, muscular endurance, and even how well your nervous system regulates stress hormones after exertion. People with strong physiological resilience tend to bounce back within minutes and feel normal the next morning. Diminished resilience shows up as lingering fatigue, unusually sore muscles days later, or breathlessness that lingers longer than it should. The genuinely good news is that recovery capacity improves as your overall fitness improves. As your cardiopulmonary fitness, strength, and consistency build, your recovery time after exertion naturally shortens. It's one of the clearest signs that your training is actually working. Quick self-check. After a brisk 10-minute walk, how many minutes does it take for your breathing to return to normal? Under 2-3 minutes is a strong sign of good resilience. I include this marker last because in many ways it summarizes everything else on this list. Recovery capacity isn't its own isolated system, it's the visible output of how well your cardiovascular fitness, muscular strength, and nervous system regulation are all functioning together. When people ask me which single sign best captures overall physical resilience, this is often the one I point to, precisely because it can't be improved in isolation. You can only get better at recovering by getting better at everything that came before it on this list. Here's a statistic that puts everything we've covered into perspective. Researchers estimate that a substantial share of age-related loss of independence, well over half by most large-scale estimates, is tied not to unavoidable disease, but to modifiable physical factors: declining strength, worsening balance, and reduced cardiovascular fitness that accumulate quietly over years of inactivity. In other words, the trajectory most people assume is simply what happens with age is, for a large proportion of people, actually a trajectory that can be changed, that reframes everything. The goal isn't to chase a single number or pass a single test once and move on. It's to treat these 7 markers as an ongoing conversation with your own body, checking in periodically, noticing trends, and adjusting your daily habits accordingly. The same way you'd monitor blood pressure or cholesterol over time, longevity isn't primarily determined by a number on a lab report. It's determined by whether your body still has the strength, speed, balance, coordination, and resilience to keep doing the things that make your life genuinely your own. Every single marker we covered today, walking speed, grip strength, cardiopulmonary fitness, balance, the ability to rise from the floor, dual task walking, and recovery capacity, can be improved through consistent training at almost any age. None of these are fixed. None of them are simply what happens when you get older. They are trainable systems, and the earlier you start paying attention to them, the more independence you protect for the decades ahead. I'm Dr. Michael Hartley, and my goal with every video is to help you stay healthy, capable, and independent for as many years as possible. If today's video gave you a clearer picture of exactly what to focus on, take a moment to subscribe so you don't miss the videos still to come. And I'd genuinely love to hear from you. Leave a comment below telling me which of these 7 signs you can already do confidently and which one you're planning to start working on this week. Until next time, stay strong, stay capable, stay independent, and I'll see you in the next video.